We'll look at the next syndrome before us, and this is what is known as a Klippel-Feil syndrome. Klippel-Feil syndrome. Okay, so mostly it's trying to look at the issues that somebody having a Klippel-Feil syndrome will face. Okay, you can see a hunchback, the chest is kind of like flattened inside, a lot of things. So Klippel-Feil syndrome is a rare congenital condition, and is characterized by fusion of two or more cervical vertebrae. So your vertebrae are actually in the neck. They are divided by an intervertebral plate, right? If it fuses, it gives you a Klippel-Feil syndrome. So it was first described in 1912 by Maurice Klippel and Andre Feil. So the whole feature, that's a hallmark feature, is we have a short neck with limited mobility, but the syndrome can also involve a lot of other systems in the body. Especially, I'm suspecting the respiratory system should be affected. So for key features, the person has a short neck, a low posterior hairline, restricted neck movement. Okay. Then pathophysiology, there's failure of normal segmentation of cervical vertebrae during embryonic development. It leads to congenital fusion of the vertebrae, most commonly the C2 to C3. Can be associated with scoliosis, Sprengel's deformity, where you have an elevated scapula and other skeletal anomalies. So associations in a musculoskeletal system can be associated with scoliosis, Sprengel's deformity, rib abnormalities. In neurosurgery can be associated with spinal cord compression or syringomyelia. In the cardiac and renal can be associated with all those heart diseases. They can also have hearing loss, sensory neural or conductive hearing loss. So clinical presentation is there's limited neck motion and there's shortened neck appearance. So neurological symptoms, you have them most of the times when a nerve is actually compressed. Okay, so diagnosis is x-rays, where you get to see that there's fusion of the cervical vertebrae. The CT scans and MRI, you are accessing the fusion and the spinal cord involvement. They can also screen the person if they have any heart issues, any kidney issues, any ear issues. You understand? A classic picture trying to show the Klippel-Feil syndrome. So management is, you can do physical therapy so that the person moves more, and the person should avoid any activity that will make them stress that part of the body too much. The surgical decompression or stabilization if a nerve is actually compressed, and also correction of associated deformities if there's a Sprengel's deformity.